Good morning. Today we are going to discuss on the arrhythmia and antiarrhythmic drugs. Now, coming to the basic of the arrhythmia and the antiarrhythmic drug, already these are the things we have discussed in our very first class, that is on you can say that impulse conduction or electrophysiology of the heart. So we have seen in the different parts of the heart when the impulse is starting from the SA node, then it is going to the AV node, Purkinje fibers to the bundle of His and the ventricles. And this is we have seen about the ECG. So that particular things I am not able to discuss. Already into the first video we have discussed the electrophysiology of heart. Now this particular portion it is we are further will discuss into the arrhythmia. Now, what is arrhythmia? Arrhythmia is nothing but the abnormal impulse formation. Clear? Abnormal impulse formation. Now, whenever we are talking about the abnormal impulse formation, abnormal heartbeat, there is a mainly two primary mechanisms are involved which responds for the abnormal impulse formation. What is that two? First one is the increased autonomicity. That increased autonomicity and after depolarization. Clear? After depolarization. So these are the two major mechanisms which is responsible for the abnormal impulse formation. Now coming to the increased autonomicity, it can be caused by the any change decrease into the time for the for depolarization. Now what does it mean? Say here if you see about that, this is the threshold potential, this is the threshold potential. So action potential it was started, so it is the normal autonomicity, it is normal autonomicity, and then here it is you can say that increased autonomicity. Here you can find that there is you can say that the time required for the depolarization reduced. Clear? Time required for the depolarization it is required in this particular case. That means the quickly the depolarization it is occurs quickly. So this particular phenomena it is known as the increased autonomicity. And in this case, increased autonomicity occurs if the rate of the diastolic depolarization in the SA node or the latent pacemaker is increased. So this is happening when there is a deep diastolic depolarization in the SA node and the latent pacemaker is increased. Clear? And it also occurs if there is a shift of the TP, that means threshold potential, if there is a shift into the TP to a more negative value. So this is about the increased autonomicity, quickly autonomicity. And next one is the after depolarization. Now in case of the after depolarization, so this is the normal ventricular action potential. This is the normal ventricular action potential. Now here you can find that are believed to the after depolarization are believed to result from the abnormal calcium influx into the cardiac cell during or immediately after phase 3. So this is the phase 3. This is the phase 3. So during or after the phase 3, if the calcium influx. Now if there is a calcium influx, what will happen? It will go. It will it will start the action potential. It will start the action potential. So after phase 3, if or during phase 3, if there is a calcium influx, so it may cause the again abnormal impulse. Abnormal impulse. Now this after depolarization also categorized into the two categories. One is the early after depolarization, that means before the ending of the phase 3 is started, and late after depolarization, after just finishing the phase 3 it was started. So both the cases, either the after depolarization or the left after depolarization, that is again responsible for the abnormal impulse. Now we'll see about the after formation of the abnormal impulse, we are talking about the abnormal impulse conduction. Abnormal impulse conduction. Now say this you can say whenever we are talking about this is the normal impulse conduction, it is coming from through the SA node, AV node, bundle of these, and then Purkinje fiber bifurcating pathway, it is there. Now, if in a region, if there is a you can say that unidirectional block into the ventricular tissue, clear? Unidirectional block into the ventricular tissue. Unidirectional block means the impulse it is not able to come here, clear? Impulse it is not able to come here, then what will happen? That will cause the retrograde conduction. This you can say that for example, if we are considering this is a right and this is a left, of course it is opposite to us, so right and left, so the impulse it will come, but here again it will propagate because there is no impulse coming from the opposite direction, so it will propagate, so that is we are calling as the retrograde conduction, and it will cause the re-entry of impulse into the ventricular tissue, re-entry of the impulse into the ventricular tissue, so it will cause the re-entry. So that is, you can say that abnormal impulse conduction. That is one type. Another type is the re-entry of AV node. Re-entry into the AV node. Now in these particular cases, what we can observe that again AV node, from AV node when it is coming, then it may be impulse may divide into the pathway alpha or the pathway beta. There pathway alpha or the pathway beta, and again they will form a distal common pathway. Again they will form a distal common pathway. Now here what we can observe that in this particular case also, this there is a unidirectional block. There is a unidirectional block in this particular area. Now for example, in the beta pathway, in the beta pathway there is a unidirectional block. If there is a unidirectional block, what will happen? This alpha again it will go down, but also it will go enter into the beta, so that is we are calling as a retrograde conduction. And as a retrograde conduction, that this alpha it will move through the beta, it will enter through the beta pathway, and this is the re-entry of the arterial tissue. That is the re-entry of the arterial tissue. So an arrhythmia is the problem with the rate of rhythm of the heartbeat. So we can say that it is a problem with the rate or rhythm of the heartbeat. During arrhythmia, the heart can beat too fast or too slowly, or there may be some irregular rhythm. When a heartbeat beats too fast, that is known as a tachycardia, and if the heartbeat is slow, that is known as a bradycardia. And then arrhythmia is caused by the change into the heart tissue activity or the electrical signal that controls the heartbeat. These changes can be caused by the damage of the tissue, injury, or the genetics. So why these changes? It may be due to the damage to the particular tissue, or some due to the disease or the genetic problem. Often there is a no you can say that symptoms, because you can say that there is a no sign and symptoms into the preliminary stages. Though some people can feel this regular heartbeat, and people may faint, dizzy, and may having the difficulty in the breathing, and this can be diagnosed with the help of the ECG. So this is about the introduction of the arrhythmia. So next video we'll see about the different drugs used into the arrhythmia.